Good day, everyone. My name is Robert Boyd, and I'm the CEO of the School-Based Health Alliance. It's my high honor to introduce our champion, Congressman John Sarbanes of Maryland. Born and raised in Baltimore, Congressman Sarbanes has represented Maryland's 3rd Congressional District in the United States Congress since 2007. He currently serves on the House Committee on Energy and Commerce and the House Subcommittee on Environmental and Climate Change as Vice Chair of the Subcommittee on Health. Congressman Sarbanes also serves on the House Oversight and Reform Committee and its Subcommittee on Governmental Operations. Hear me, folks. John Sarbanes is the long-term champion and advocate for school-based health centers in the United States Congress. In 2016, Mr. Sarbanes was the lead House sponsor for the Hallways to Health Act, the first comprehensive federal school-based health center bill. And we have worked closely with his excellent staff to improve and expand on this bill in subsequent sessions, growing the list of bipartisan sponsors. In 2019, he introduced H.R. 2075, the School-Based Health Centers Reauthorization Act, a bipartisan bill to reauthorize funding for SBHCs. In July 2020, his leadership was instrumental in securing the first ever congressional hearing on school-based health centers when the Energy and Commerce Health Subcommittee considered the School-Based Health Centers Reauthorization Act of 2019. The momentum from this hearing led to the bill's inclusion and passage into law in the FY21 appropriations bill, along with the inclusion of $5 million for school-based health centers within HRSA's Health Centers program. This funding supported grant awards to 27 school-based health center sponsors that are federally qualified health centers, or FQHCs. Just 3 months ago, the FY22 appropriations bill increased that amount to $30 million, which has already led to $25 million in grants to an additional 125 FQHCs that sponsor school-based health centers. And last week, the House Appropriations Committee recommended $100 million for new and expanded school-based health centers, regardless of what entity is sponsoring the center. The pandemic has brought a new focus on the importance of school-based health to Congress, and Congressman Sarbanes never misses an opportunity to mention the value of school-based health centers in hearings. We also want to thank his staff, particularly Teresa Chalhoub and Devorah Lovinger, both of whom we've enjoyed a close working relationship for many years. As a former chief of staff myself, I can tell you, Congressman, you have the best staff. Therefore, on behalf of all who labor in school-based health, we are honored today to present Representative John Sarbanes of Maryland with our 2022 Congressional School-Based Healthcare Champion Award. Ladies and gentlemen, please welcome our champion, Congressman John Sarbanes.
Well, thank you very much, President Boyd. I appreciate those extremely kind words, and I thank you for the recognition, but I think I'll channel it back towards you, your organization, and all the people that are on this call today, because it's your advocacy that has allowed us to make such tremendous progress in Congress over the last few years. As you indicated, I have been sort of toiling in the vineyards on this issue of lifting up school-based health centers across the country and bringing real focus to the broad set of really consequential services that can be provided to our young people in their schools, this captive audience that we have. And I think with that comes a special responsibility. Just to take folks back a little bit, I came to this issue through a combination of things. One was my own interest, having spent almost 20 years before I got to Congress working with healthcare providers in the state of Maryland, and getting not a direct sense, but a very indirect sense, a powerful one, of the difference that healthcare professionals were making in our schools and how that was contributing broadly to our public health and to the services that we try to deliver to all Marylanders and all Americans. But I also was blessed to intersect a little bit with Lois Cabbs, who was a member of Congress. She served on the Energy and Commerce Committee. She herself was a former nurse, and she had led this effort for many, many years. So we devised a smooth handoff of stewardship of the issue of school-based health centers from Lois to myself, and I've been very proud to lead this effort ever since. So I want to thank you for the tremendous work of the School-Based Health Alliance in getting us to a very good place, I think, to continue to build as we move forward. As you indicated, we had a breakthrough in 2021, fiscal year 2021. We got $5 million secured in the appropriations bill to support school-based health centers. And we built on that in 2022 with the help of your organization and others that have come together as a coalition in this space. I was working with allies in Congress, Ayanna Presley, and Representative Gomez and others who helped us get the word out among our colleagues and to the relevant appropriation committee that we wanted to plus that amount up again, and we were able to get $30 million for school-based health centers in the FY 2022. So we decide, why not keep building on that? And the request this year was for $200 million, $100 million of that to go to school-based health centers in the 330 funding space, and $100 million to those who are not, because we want to make sure this is as comprehensive as possible. Early signs are that we've got about $50 million allotted in both baskets in the draft appropriations bill in the relevant committee. That's not a guarantee at this point, but it's a good sign that the message we've been carrying and that you've been carrying for a long time, that investing in school-based health centers is an efficient use of dollars, that message is getting through, and I think it's one we can continue to see resonate as we move forward. So whether it's getting dollars through appropriations, whether it's getting the authorizations that we need to keep this front and center as a critical intervention and support for our young people across the country, we're going to be championing this moving forward. And again, I want to thank you for all of the work that you've done and all the professionals that are on this call today. Let me close with this. Whatever the pressures were that being felt in our schools in terms of gathering up resources, whether that's in the primary care, physical health space, or whether it's in the mental health space. Whatever those were before the pandemic, we know that they've exponentially increased in the middle of this pandemic and through this pandemic. So those
Whoops, did we lose the congressman? Hello. Hi, everybody. I think we lost the congressman for a minute. Hopefully we'll get him back. Did we get him back? Stay with us, folks. Okay, so we have the congressman's voice, but not his video. Is that right, Congressman? I'm not hearing anything. So, folks, now's a good time to put questions into the chat for Congressman Sarbanes. We're trying to get him back on video. We should have that in a second. As the Congressman said, there's no guarantees as to what's in the what's in the Appropriations Committee's package is going to go forward. But we need all of your help. We need you reaching out to your congresspeople, reaching out to your senators, and asking them to support the appropriations request. Again, it didn't go in at the 100 and 100 level that we wanted it to. 100 million for FQHCs and 100 million for non-FQHC sponsors, but it did go in at 50 million and 50 million, which would be a $70 million increase over the previous FY22 budget. So it's an exciting time, and we have these great champions that are supporting our efforts, and we need your continued support as we go forward. Have we got the Congressman back? Congressman, can you hear me? Ah, there, I got his face. Can you hear me, Congressman? Congressman? Congressman, can you hear me? You are back. Can you hear me, Congressman? All right, everybody, stay with us. He's going to switch over to a different. Can you hear me?
I can hear you. Can you hear me?
I can hear you now. Go figure.
There we go.
Okie doke. So
we're back.
We missed your closing.
Okay. I will close with this. I was just about actually to talk about the promise of telehealth in our schools at the moment that the technology failed us. So we obviously need to improve our technology on all fronts. But again, thank you very much for the extraordinary service that you've delivered, particularly to our young people in the midst of the pandemic. But what I was just closing with is we do think there could be some significant resources flowing to our schools, and recognizing the value of school-based health services to try to address some of the stresses that our students and faculty and others, school personnel, are feeling as we try to tackle with this issue of gun violence across the country. So there's so many pressures. Again, I can't thank the professionals enough for the amazing work that you do. And with that, Robert, thank you again for the recognition, but it's really recognition that should go to all those that are on this call. Continue to do the great work that you're doing. It makes a huge difference.
Thank you, sir. As you know, there's hundreds of people on this call from across the nation. What do you need from us? What can these folks on this call do to support your efforts on our behalf? You just do so much for us. What can we do to help you? So, two things in particular, I would say. The first is just continue your advocacy, because you can see it's made a tremendous difference so far. We don't want to let these changes and these advances we've made falter. So continuing to stay strong with the advocacy, being a part of the School-Based Health Alliance, and otherwise making lawmakers and policymakers at all levels of government understand why it's so important to get these services into our schools. The second thing you can do is, as we begin to invest these resources in a significant way, collect the best practices that's helping to fund, and do your best to kind of digest that or distill that into evaluation of what's working and what's not working, because that's really important.
information for us to have as policymakers, and it can justify the investments that we're trying to bring to bear. And nobody understands better how to connect the dots on that and evaluate what's working or not working than professionals on the ground in the schools, which are the people on this call. So I appreciate you're doing that. That's a little bit of a homework assignment, but I know it's something that you would do anyway, and it will definitely help us as policymakers.
Awesome. Hey, I'm going to ask you a similar question to what I asked Senator Wyden, and that's, Congressman, put your crystal ball, look into your crystal ball for us. Do you think we're going to see an FY23 budget approved either before the midterms or in the lame duck before the end of the Congress? What are you thinking right now? I know we can pass stuff out of the House.
You give me great credit for having a crystal ball to even look at. I wish there was one around here. Look, we're making a very good case for the enhanced funding that we're seeking as part of the appropriations. Everything becomes quite political as we head into the final stretch of a campaign cycle, as you know, and you've been on the Hill. You appreciate what happens as we get into the last days of any Congress and session of Congress. I do think that whether it's a continuing appropriation where we just kind of move the ball forward from what we were able to get past last year, which could happen given the politics of the situation, or whether we can actually get a new round of appropriation bills passed and onto the president's desk. There will be dollars there for school-based health centers. I think how much depends very much on which avenue we go. If it's just a continuing resolution, then hopefully we can keep that $25–30 million number in place from last year. If we're able to get some new appropriations put together, then we can reach for the higher amounts. I do think, again, that there is a new level of appreciation for what schools can offer to young people and why young people need our support right now. So you put those two things together, I think the support and appreciation for school-based health services is here to stay. And whatever form that takes at both the federal, the state, and the local levels, I think it can make a tremendous difference. Again, with the advocacy, expertise, and insight that the professionals on this call bring to bear every single day.
Last year, when we went for appropriations, we tried to get the appropriation for both the 330 program, the FQHCs, as well as the non-FQHCs. Where do you see us coming down? Again, I know it's another crystal ball question.
Well, but we've made progress. Yeah, we've made progress there because up until this point, the funding has been limited to the 330 category of school-based health centers. But in at least the draft bill that the Labor HHS committee is putting together right now, they have recognized that putting dollars into both baskets is important because we understand that's how you cover the waterfront here. So that's a breakthrough. Now, I don't know if that draft bill is going to be ultimately what the final one looks like and whether the final one is what we end up passing as opposed to just pulling forward appropriation from last year. But we've made a breakthrough, and I think it's a very important one in terms of giving as much coverage to this as we possibly can.
And the communications from the field to their Congress people as well as their senators needs to be about this appropriation right now.
Absolutely. And I mean, you've been well organized in the past to make sure that the word is getting to the key legislators. We know who those people are. The School-Based Health Alliance has a good strategy for making sure that the voices of people in the right states and districts across the country that's being directed to those people. So we'll continue to collaborate on that and make sure this coalition is having its voice heard at this critical moment. But the moment is now because this is when the various committees are tackling the appropriation issue.
That's fantastic. How much more time do you have, Congressman?
I have about 5 minutes. I could take a couple other questions if you have them. I don't want to get in the way of the rest of your your agenda, but
no. This is an important time for our folks to get to know you and to, you know, I'm going to deviate for a second to more of a personal question, because this one I just have to ask. We know you as a down-to-earth guy. We know you as a person of the people. Is it true you really drive yourself to all of your own events?
Absolutely. And I'll tell you a funny story. I've upgraded slightly what I drive, but a few years back, I was driving a tired old Ford Focus that had a lot of dings on it and just was the worst for wear. And I showed up in an event in my district, and I put the window down, and the attendant came over who was helping to park cars there. And he said, "Can I help you?" And I said, "Congressman Sarbanes." And he looked at me, and he looked at my car, and he looked at me again, and he said, "When will he be getting here?"
You didn't have your pin on.
I said, "Yeah." I said, "Well, actually, I am Congressman Sarbanes, even though it may not appear that way." So I try to keep it real. I put a lot of miles on my car because I commute every day, and I don't necessarily take it to the car wash as frequently as I should. But frankly, driving yourself is a good way to get some me time and be able to think things through. And I try to apply that towards my due diligence as a lawmaker.
Yeah, and with gas prices, you probably wish you still had that focus.
That's true.
The gun bill that just passed.
Yeah.
A lot of emphasis on mental health and in schools, and providing resources for mental health in schools. Is there any chance that, or any concern that Congress is going to simply look at mental health and say, well, we've already done that for schools, we're not going to focus on the other health issues that school-based health centers address, like primary care and wellness checks and vaccinations and all the things that we do, oral and vision care? That's a real concern in the field right now, that so much emphasis is on behavioral and mental health, and it needs to be there. It's been a crisis, as we all know, for a long time. But there's a concern that it's taking eyeballs away from all of the other things we do in school-based health. Is that any concern of yours?
Yeah, I share that concern. I think it's a fair one. I do think, though, that any attention we can bring to the suite of services, the full spectrum of services that can be offered through school-based health centers and other school-based health services, is an opportunity then for the professionals to lift up the benefits across the board. And the fact of the matter is that attention is now coming because of the concern around mental health services and behavioral health services. But once the attention's there, I'm very confident that professionals on this call can make the strong argument that you can't trade one for the other, that you need all of the various services, that the research, I mean, this is the thing, the evidence-based research on the impact that school-based health services can offer when it comes to primary care services, mental health services, behavioral health services is undeniable. And so if we get the attention to these things, and then we're able to put that research in front of policymakers, I think we can resist whatever tendency there might be to sort of pull resources away or to kind of trade one thing against the other. But it's a fair concern. You're right to bring it up. I'm certainly going to keep my radar up about that, as I know you will.
Amen. Amen. Well, we know you have a lot of other things to do, Congressman, and we are so grateful for this time that you've been able to share with us. We look forward, as we get ready to do back to school, to visiting some school-based health centers in your district with you. We think that would be important, both for the morale of the folks that are working on the ground, but also, you know, again, just to put the spotlight on the important work that our folks are doing out there in schools. So on behalf of all of us, as I said several times, you are our champion. You've carried this when nobody else was listening, And we are just so grateful that you've been stalwart and you've just hung in there with us. And it's exciting for all of us, but I know it has to be gratifying for you to finally see the kind of progress that we're seeing with other people.
Thank you again. You know, they say 90% of success in life is just showing up. Well, we've been collectively showing up on this for a number of years, and we're having some success. As I close, let me just again thank those who are participating today, who are the professionals in our schools that are making a difference. And I particularly want to recognize that I understand there's a lot of shortages right now across, well, frankly, across every single job category in our country, it seems. But I know that in schools, there are shortages of nurses, social workers, counselors, and so forth, even in the places where the funds exist. And as more funds get directed towards schools, we've got to really keep our eye on the workforce shortages and make sure the training opportunities are there, think out of the box about what that looks like and how we can be as creative as possible. I'm just about to reintroduce a bill, for example, that would try to encourage physicians to re-enter practice who've left the practice. And one of the places that they would be authorized to go provide services would be in school-based health centers, as one example. So that workforce shortage is important to address. I know it's something that many on this call are feeling. You're doing double and triple duty in some places. I thank you for carrying that burden, but we'll hopefully be able to try to relieve that as we move forward. So thank you all very much for the opportunity. Robert, thank you for your leadership and the leadership of your team, and look forward to continuing to work together as we move forward.
Thank you. God bless you, sir. We'll see you soon.
All right. Take care. Bye-bye.
Bye-bye. Folks, if you're out there in the field and you're trying to figure out, hey, how can I help Congressman Sarbanes? How can I help SBHA move these initiatives forward? Contact your state affiliate. And if you don't have an affiliate in your state, reach out directly to us, to Tammy Alexander on our team, and we'll connect you with folks in your state that are trying to assist with advocacy on this. The congressman gives us a lot of the credit, but a lot of the credit goes to those of you that were out there on the ground in Oregon, in Washington State, in Connecticut, and in the other key states where key leadership of these committees, you know, are from, and showing them what's happening on the ground. It's just been critical. And so we really need your continued support. So reach out to your state affiliate. And if you don't know how to do that, reach out to us and we will connect you. It's now my opportunity to introduce a good friend who's a member of our board of directors, Mark Maselli. 50 years ago, he co-founded the Community Health Center, Inc. in Connecticut. And a few years later, the Weitzman Institute, which is a critical partner of ours in providing resources nationally. I'm going to have Mark come on, and he will introduce our next speaker after him, who will be Secretary of Education, Cardona. Thank you, and all of you be well.
2022 School-Based Healthcare Conference. I'm Mark. Greetings and welcome to the 2022 School-Based Healthcare Conference. I'm Mark Maselli, and I'm President and CEO of Community Health Center, Inc. and the Weitzman Institute based in Middletown, Connecticut, and a member of the School-Based Health Alliance Board of Directors. On behalf of our President and CEO, Robert Boyd, and the entire School-Based Health Alliance Board, it gives me great pleasure to introduce a true friend and champion of school-based healthcare, U.S. Secretary of Education, Miguel Cardona. Dr. Cardona is the 12th U.S. Secretary of Education and has dedicated his career to serving students, educators, families as an elementary school teacher, a school principal, a district administrator, and most recently as Commissioner of Education for my home state of Connecticut. Secretary Cardona's focus on equity and excellence for all learners has driven his work at every level of the education sector. He led the federal government's effort to support states in reopening America's public schools for in-person learning amid the recovery from the pandemic, moving from only 46% of schools open when President Biden took office to nearly 100% of schools open today. Under Secretary Cardona's leadership, the U.S. Department of Education also has distributed historic funding through the American Rescue Plan to support K through 12 schools and colleges, and has granted more than $13 billion in school loan forgiveness. Secretary Cardona earned a bachelor's degree at Central Connecticut University, as well as a master's degree and a doctorate from the University of Yukon. Go Huskies. He's a proud son of Meriden, Connecticut, where he makes a point of returning as often as possible and where his family remains based. I first got to know Secretary Cardona through the Community Health Center's health center based in Meriden and our robust school-based healthcare network, which now extends to more than 180 schools throughout Connecticut. It was clear early on, while the secretary was a high school principal, that he was going places. Just a few weeks ago, Secretary Cardona came straight from DC on Friday evening on the start of a Memorial Day weekend to help our health center celebrate its 50th anniversary on the campus of Wesleyan University, where we got our start. His very talented teenagers, Celine and Miguel Jr., were part of the program that night, captivating the crowd with 2 songs performed in Spanish. You know, I dare say Dr. Cardona will not be the only member of the family achieving national acclaim. What was most endearing was watching Miguel and his lovely wife, Marissa, an alum of our health center, watch their children perform. In heartfelt remarks delivered after the performance, he told the story of how he and Marissa first met on the Wesleyan University campus and proclaimed he was above all a proud dad. So please join me in welcoming a proud dad and our nation's Secretary of Education, the Honorable Miguel Cardona.
Thank you, Mark. I'll always appreciate your commitment to the health of Connecticut families. And thanks to Robert Boyd for the invitation today. To all the counselors, the social workers, nurses, and educators, thank you. At times, the pressures of the pandemic brought you to your knees, but you always got back up. You got back up because you didn't want to let your students down. As a nation, we've come a long way. When I took office last year, just 46% of our schools were open for full-time in-person learning. By the spring of this year, nearly all schools returned to in-person learning. As we focus on recovery, we must face how the pandemic widened inequities in our schools. You're seeing it firsthand. You're also seeing how the pandemic exposed so many children to trauma, to loss, and to social isolation. Rates of youth anxiety and depression are climbing. Yet, too many underserved students lack access to care and supports. For an equitable recovery, we must reimagine how schools meet the social, emotional, and mental health needs of their students. My department is helping school leaders use American Rescue Plan funds to level up their supports. Already, we've seen a 65% increase in social workers and nearly 20% increase in school counselors. President Biden has called for a whole-of-government response to the nation's mental health crisis. I'm proud that Health and Human Services Secretary Javier Becerra and I are working together to promote greater access to school-based health services. The President's budget also calls for $1 billion to hire more health professionals and provide professional development on supporting students' social and emotional well-being. It's time to think big. Earlier this year, I visited a high school in Michigan that devoted an entire period to students' social and emotional mental health each day. Imagine if every student had that support. We're also calling on Congress for dramatic investments in community schools. Earlier this year, I met a high schooler in New Mexico who was involved in a physical altercation. He credited a community school's restorative justice program funded by the American Rescue Plan with saving his life. Many of you have had similar stories about students you've helped. When the going gets tough, these stories keep us going. I know these are tough times. Sometimes there are political efforts to sow division in our schools, but we have to get past that. Let's expand meaningful, constructive engagement between parents and educators. Recently, our department launched the National Parents and Families Engagement Council, a new tool for parents and caregivers to support their children's learning, to understand their rights, offer feedback, and take advantage of enrichment opportunities for their children. I'm excited to see how we can continue to work together to serve the best interests of our students. Every day, across America, students are counting on us to help them heal, to help them overcome, and help them realize their true potential. No one is more informed, more passionate, or more prepared to do this work. Thank you for your care, and thank you for your courage. I'll always have your back.